Hello, thank you so much for joining me. My name is Frances Wu from the Healthcare Improvement Studies Institute, and I will be presenting our work entitled Beyond Culture as Culprit, the Influence of the Informal Organization on Employee Voice in Inpatient Care. First, I'd like to thank my co-authors listed here for their valuable contributions to this work. By way of background, employee voice, or the discretionary communication of ideas, suggestions, or concerns about work-related issues with the intent to improve organizational functioning, has been of increasing national interest in the last several years. Yet healthcare staff remain reluctant to give voice to concerns. Failures in performance within organizations have often been attributed to poor organizational culture, which is described by Mannion and colleagues as the values, beliefs, and assumptions within organizations and the behavior that arises from them. Organizational culture, however, is a multifaceted construct, and efforts to change culture should be informed by a nuanced understanding of it. Relevant insights can be found in research on a much older construct in organizational behavior, the informal organization, that has commanded sociological attention since the mid-20th century. So in this study, we're going to explore the role of the formal and informal organizations in hospital employees' perspective on the use of voice. We will explore the following questions. How does the informal organization support or discourage voice behavior? And how does it interact with the formal organization to make voice more or less likely? In terms of theory, formal organization has been described as the codification of how individual parts do their work and how they relate to one another. This includes things like human resource practices and job design, for example. Org theorists felt that the organization wasn't reducible to formal role definitions and written rules. They acknowledged that there existed a gap between the formal organization and what actually happens day to day. The informal organization then is considered the contacts or interactions that are repeated without any specific conscious joint purpose and associated groupings. Chester Barnard suggested that the formal and informal organizations are interdependent and that informal organization need not be viewed as threatening, especially from the perspective of management. In fact, the latter help to offset some of the more dehumanizing parts of formal structures, such as bureaucracy, and help employees to communicate, maintain cohesion, and protect dignity of employees as individuals. This is a qualitative study that involves semi-structured interviews in 3 academic medical centers. The first site was chosen pragmatically. It had commissioned a study after experiencing a patient safety incident. The second and third sites were selected to test generalizability. Both senior leaders and frontline staff, such as physicians, nurses, technical and administrative staff, building and housekeeping staff were included. Because of the sensitive topics, the recruitment approach emphasized confidentiality. Emails describing the study and assuring confidentiality were sent from the leadership of each department covered by the study, providing a link to a confidential response website. Individuals who provided contact information through this response website were given additional study information, and telephone interviews were arranged with those agreeing to participate. Each participant completed a verbal consent process. All interviews were digitally audio recorded, and a third-party professional transcription service transcribed the interview. Data analysis was based on the constant comparative method. The study reviewed ethics approval in 2 sites and was deemed quality improvement, and thus exempt from ethical review in the 3rd. So in total, 165 participants were interviewed, 57 with senior leaders, and 108 interviews were conducted with frontline personnel. This table shows the breakout of interviews conducted across the 3 study sites. This 2x2 table summarizes the interactions between the formal and informal organizations that we found. So starting here more generally in the column header, we found ways in which the formal organization supported voice behavior as well as ways in which it was unsupported. This was similar for the informal organization. We found ways, again, when it was supportive and other times when it was unsupportive. So taking the two together, there were times when the informal organization complemented the formal organization, such as in themes 1 and 3. And then there were other times when it worked against the formal organization to either encourage or discourage voice behavior. And this is in themes 4 and 2, respectively. So in the next few slides, I'll highlight these results. Starting with the top left in theme 1, we found examples where the informal organization supported formal expectations around voice. In the interviews, participants described an elaborate formal organization with clear expectations around speaking out in the moment about immediate dangers to patient safety and clear procedures for speaking up about ongoing risks and concerns. Yet, participants generally expressed a preference for speaking out about concerns with their colleagues ahead of raising issues with managers or through other mechanisms for speaking up. They relied heavily on informal networks to navigate such interactions. So, as one frontline personnel described, you can have a more casual and laid-back attitude about things within the same group. You know, if I lean over and tell my co-intern that they're ordering something on the wrong patient, which we've all done, like it's not that big a deal. You're socially friends with a lot of who you work with, so it's not a big deal to send an email and say, hey, what happened last night? Or why did you order this? We also found examples where informal organization impeded the informal organization's expectations around voice. These manifested most clearly in an informal social hierarchy, which defined patterns of relating and behaving and acted to suppress voice in many instances. As one senior leader commented, the other group that I think is vulnerable are the folks who would consider themselves lower in the hierarchy. Now, we all know we shouldn't have that kind of hierarchy. We should function as a team. But if you ask them, they would say, well, I don't want to speak up because the physicians, they retaliate. So the folks who may not have the same training level, technicians on the floor, young nurses who don't have a lot of experience. The informal hierarchy broadly mirrored the formal organizational order, but the influence could extend well beyond formal accountability through the chain of command and heavily influence social dynamics, including that related to speaking. Moving now to the right column, the formal organization itself at times sent conflicting signals regarding the propriety and consequences of speaking. Respondents described how some procedures were often difficult to follow, not well suited to the types of concerns encountered, or inconsistently adhered to when concerns were raised. In theme 3, the informal organization discouraged voice in the face of such formal conflicting signals. We found times when it replicated the imperatives of the formal organization in prioritizing efficiency and expediency. Several sharp-end participants describe voice as a matter of unwanted disruption and use terms describing speaking such as rocking the boat, creating trouble within the team, complaining, and whining. So in this way, informal social norms thus reinforce the message from the formal organization that voice was not always to be valued. One frontline worker commented, "You get the impression if you're a team player and you work within the structures and cross your T's and dot your I's and don't raise things, then you're more likely to do well within the organization." And finally, in theme 4, informal organization helped to overcome reticence in the face of formal conflicting signals. We found various ways it worked to mitigate negativity towards voice. For example, informal interactions with colleagues were more important in helping staff to make sense of the concerns that troubled them, to form a sense of how likely or unlikely the formal organization was to take them seriously, and to gauge the potential personal risks that might arise from a decision to speak up. As one senior leader described, the classic example is a new nurse, and before she would even get to the chain, she'll talk to her colleagues first. Then she'll talk to the charge nurse, then the nurse manager, and rally the forces around her. So, is this the right thing? And how should I say it? And planning and scripting it as opposed to, let me just pull you aside and have a cup of coffee kind of thing. And that suggests to me that she doesn't feel protected in doing it herself. To wrap up, we found a complex relationship between the informal and formal organizations. The role of the informal organization was much more complex than simply supporting or undermining formal policy. Sometimes it complemented the formal organization in encouraging voice, and sometimes it worked against it. But despite all three organizations' multifaceted approach to encouraging voice, the signals communicated by the formal organization were themselves not always consistent. There were several instances when the informal organization played a crucial role in helping staff to navigate such inconsistency and negotiate the trade-offs between potential benefits, downsides, and personal risks. In terms of practical implications, our findings suggest that perhaps it's less organizational culture and more the inconsistency with which formal policies are applied that is at the root of much of the reticence around voice. So ensuring that formal policies are both clearly specified and consistently applied should therefore be a priority. Our study also points to the importance of the informal organization in helping staff make sense of the sometimes conflicting messages they receive about speaking. The function of the informal organization might be developed through interventions such as skills training around communication and elicitation for middle managers. And for staff, communication strategies for informally raising concerns with colleagues may be helpful. Thanks so much for listening to this presentation. If you have any questions or comments, please add them as a comment below. We'll read and respond. Thanks again.